Right. The thing is, not a single person that I invited is on yet because I have to resend their link. So I would need like another 3 minutes.
Okay.
This is an unfortunate situation, but I guess we have to pivot.
It is what it is, so we just deal with it while we're here.
Okay. Apologies to the members of the public. There was an error with the meeting link, so I'm just sending out some updates to neighbors who had expressed interest in attending today. But is everybody who needs to be on in terms of the support staff? I just want to make sure that everybody's at the table before I start the meeting. Tammy.
Yes, ma'am.
Stephanie, Chase, Chief. Okay, cool. I see you, Chief. Okay. So the meeting of the Criminal Justice Reform Committee is called to order at 2:09 on what's today, August 2nd. I'm here. Mayor's here.
I'm here.
Shane's here. Hello, Shane.
Hello.
So if we want to, what did you recommend, Mayor? Let's do the
Well, we
meeting
need to do
minutes.
the minutes, and that would give a little bit of time.
Okay. Mayor, will you take it away from here so that I can go ahead and keep on sending these updated links, please?
Give me a second to grab a copy of the agenda.
Okay, I apologize. It looks like some more folks are coming on. Excellent, cool. And I think Miss Tammy, you sent out corrections that the mayor sent, right?
Yeah,
Yes.
it said that I would contact Heather at the Daily Record, and it's Heather at the Community Impact.
Yes, ma'am, and that has been corrected. Thank you so much.
So outside of that, I would make a motion to accept the minutes with that correction. Is there a second?
Okay.
Second by Ms. Garza.
Let me
All
see
in
it.
favor?
Aye.
Aye.
Okay, unanimous. And Ms. Garza, can we go ahead and let Chief Standridge start with a little bit of the background, and we'll hope more
Yes,
folks can get
yes.
on before we actually get to the presentation.
Yes, ma'am. I agree.
Chief?
Thank you. Committee members, I appreciate this opportunity. What we are going to endeavor to do is to take years of research and best practice policies, statutes, and try to condense those into a teachable, learnable environment in now what's about 48 minutes. I will do my best, but I'm just going to tell you right now to all of our citizens, we are going to somehow provide access to all of the resource materials that I have referenced, and you're going to see they're voluminous. They literally are probably about 3 to 4 inches in depth. That's how much material that I have reviewed in making this presentation. But we will provide all of that source material so that you can be better informed as it relates to mental health and the often co-occurring substance use disorders that are faced in San Marcos, Hays County. So with that said, I want to begin with a national perspective. National statistics estimate that about 18% of all Americans 18 and older, which equates to about 1 in 5 adults, struggle with mental health problems every year. 5% of Texas's population has a serious mental illness, and that SMI, serious mental illness, is going to have an associated legal statutory definition. I want to talk about what is considered a serious mental illness because that frames the conversation as to who and how people receive services in San Marcos and Hays County. So when we talk about mental health and we talk about mental illness, not everybody's on the same page. So I want to offer that same page qualifier. Serious mental illness includes, but is not exclusive of, major depressive disorder, PTSD, schizoaffective disorder, obsessive compulsive disorder, anxiety disorders, attention deficit disorders, delusional disorders, eating disorders, and the caveat, any other diagnosed mental health disorder as defined by the DSM-5 manual. What does that mean? So the policy, the statutory provision associated with this is what's called the Diagnostic and Statistical Manual of Mental Disorders, and it's the 5th edition. That's why it's referenced to as the DSM-5. Now, before I go further, I want to say for everybody's benefit, I believe joining us this afternoon is Todd Citron. Todd Citron is the CEO of Hill Country, and I think also is Amy Lowry. She is the clinical director for the Scheib Center, which is part of the Hill Country Services for San Marcos, Hays County. I believe both of them have joined. I know Todd is here. So if you all ask a question that I cannot, they certainly can. So we better understand what exactly is a serious mental illness. That's the list that I just read to you. But how are services actually provided to our citizens who suffer from these mental health issues? And oftentimes, as I mentioned a minute ago, the co-occurring substance use disorders. Now, I want to say from the onset, this is not an abstract conversation for me. It's also not a strictly professional conversation for me. This is a very personal conversation for me. Through my life, both in childhood and adulthood, my immediate family has suffered what is called COPS-D. And COPS-D is an acronym that stands for co-occurring psychiatric and substance abuse disorders. So that is framed who I am personally and professionally. So when I speak about these issues, I speak both from an experience perspective, but also speak as your police chief that is trying to bring greater services by partnering with others like Todd and Amy and others. So for that reason, this issue has always stirred me personally and professionally. I serve as a commissioner for the Judicial Commission on Mental Health. I'm one of 2 law enforcement representatives for the state of Texas. And I want to endeavor today to really give our citizens a behind the curtain perspective on these issues in San Marcos and also somewhat Hays County. Now, give me a lot of grace because, as I said years before, we need to distill years of research, best practices, and data into less than an hour. So how does Texas proceed with offering services for serious mental illness? Well, Texas uses what's called the TRR model. The TRR model is the Texas Resilience and Recovery Model. And they use that TRR model for evaluating residents and then providing subsequent services. Now, this model acknowledges that people experience mental health issues on a continuum. Some need very few services. Some need the full continuum of services. So the TRR model, the Texas Resiliency and Recovery Model, accomplishes this by dividing levels of care into basically 0 to 5, with 5 being the absolute most intensive. But today, for today's perspective, we're really going to focus only on 0, 1, 2, 3, and 4, because that's what we typically see on the front end with us. Again, 4 being the most intensive of services provided outside of confinement. So let's start with level 0. Level 0 is typically the level of care that you receive for very brief interventions associated with crisis. The crisis manifests, resources are immediately deployed to diffuse the crisis situation and prevent utilization of more intensive services. So with level 0, the desired outcome is resolution of the crisis, obviously, and avoidance of more intervention. If more intervention is required, then you move to level 1. Level 1 is inclusive of providing medication support and or skills support. So the general focus of level 1 is to prevent deterioration of a person's condition through medication therapy and skills-based support. In other words, this is outpatient treatment that the client would receive in hopes of preventing crisis, in hopes of not triggering the system. Now, some people need higher definitive care, so you can move to level 2. Level 2 is intended for individuals with symptoms of major depressive disorder, but they present very little risk of harm. They do have some support systems. They have a level of functioning that does not require more intensive levels of care like inpatient treatment, but they could benefit from psychotherapy. Now, many of us, I don't want to say many of us, people like me and my family would sometimes fall into level 2 because, again, you may have people associated with major depressive disorder. They're not necessarily a harm to themselves or others. They have a fairly high level of functioning, but they could benefit from some type of therapy that is offered through local services. So that level of care is designed to improve their level of functioning and prevent deterioration. Let's say, however, the person continues to deteriorate. So now you need to move to level 3. Now, level 3 is an intensive provision of services, and it has a team approach versus what you would think of like an individual counselor. This is going to actually trigger a team approach to the person who's in crisis. Level 3 has services which are generally intended for individuals who enter the system of care with moderate to severe levels of need. They require intensive rehabilitation to increase their community tenure, to establish support networks, to increase their community awareness, and to develop coping strategies. That's a huge issue. Now, those coping strategies may be going back up to that level 1. It may be a medication issue. It may be a skills issue. It may be a housing issue. It could be an education issue. Level 3 is going to trigger that team approach that can provide a more comprehensive response to the person in crisis. And you're going to look at it more along the person's ecological environment. You're going to look at family, peers, school, so that you can provide a more holistic intervention for the person experiencing level 3 care. Level 4 is, again, at the local level, the highest level of care, and it's what's called assertive community treatment. It uses a very integrated services approach in the fact that it merges the clinical, think psychiatrist, it merges that clinical with the rehabilitative staff expertise that you may find with your local mental health authority. And they are going to tackle issues for the person who cycles in and out of incarceration, the person who may have been under an emergency detention not once, but twice, maybe 3 times, who is routinely suffering from suicidal or homicidal ideations. This is the person that may be a high frequent utilizer of services. The level 4 assertive community treatment is designed to provide a very comprehensive overlay of services through a mobile service delivery team. Now that's really key. This person is not incarcerated for level 4. This person is outside, they're in the community, but they have extensive needs. And so you're going to overlap the psychologist, the psychiatrist, the substance abuse, the employment, the housing. You're going to take a very comprehensive approach so that you can try to ensure that this person can move to a point of recovery and they stop their decompensation. So these are the levels of care that are determined after a client is assessed. Now we as in San Marcos, as in Hays County, as in the entire state of Texas, we use a standardized assessment. It's not something that we created locally. This is used across the state so that we have a regular routine instrument to assess people as it relates to what level of care they qualify for. So the question is then begged, how many people I can only speak for San Marcos, how many people in San Marcos are needing these level of services? I'm going to give you a data download, courtesy of our crime analyst, Martha Chumchow. And please know, in August 2022, the police department transitioned to a new records management system. Again, August 22, new records management system moving forward. So I'm going to provide you data from August 2nd of 2022 to July 20th of 2023. That's 353 days. So there were 1,932 mental health related calls or investigations in those 353 days. Of those 1,932 calls, 1,179 originated with 911 or the non-emergency line. So think about that. 1,179 calls originated with 911 or the non-emergency line. We still see that the number one portal for a person to receive services in San Marcos, in Hays County, and in fact, in the entire state of Texas, continues to be through 911. That's got to change. We'll talk about the future in just a little bit. But I want us to focus for now just on the 1,179 calls. We're going to break those down. So of those calls, 217 ended in an emergency detention. So the state of Texas, through the Health and Safety Code, allows a peace officer to civilly detain a person after they're screened by the local mental health authority. The person can be taken to what's called a CSU, a crisis stabilization unit, and they can be held up to 72 hours under civil confinement because they are either suicidal or homicidal. So again, of the 1,179 calls to us, we did emergency detentions on 217 of our citizens. Now that means that 962 calls were handled without an emergency detention order. Of those 217 detentions, you please know that 118 of them were related to a known mental health issue. In other words, when officers were en route, when police, fire, EMS were en route, they knew from the onset of the call that the nature of the call was dealing with a mental health client. Typically, we see that the family is the one that is calling. The family tells the 911 dispatcher, this person's in crisis. They are not taking their medications as prescribed. Help. So we respond. 118 of those emergency detentions were exactly that. We knew what we were going to. 90 of the 217 were responses to suicide. That's quite a bit of number, quite a few numbers. 353 days, we responded to 90 threats of suicide, resulting in emergency detention. Now, who's handling all of these calls? The patrol division, the blue suiters, what everybody associates with uniformed services. They handled 72% of these calls. 17% of these calls were handled by a full-time mental health unit. The mental health unit was established, I believe, under Chief Staff's tenure with the San Marcos Police Department. And we have 3 full-time employees. We have a corporal and 2 officers, and their full-time employment is associated with responding to mental health and the co-occurring substance use disorders in the city. Now, they did 17% of those 1,179 calls. Patrol did the other 72%, and I'll get to a remaining number in a minute. What does that tell us? That tells us we need to grow the mental health unit. We need mental health certified peace officers responding to more of these calls, not less. Now, I want to brag on City Manager Stephanie Reyes and Chief Staff and the entire City Council. Thank you, Council, because you allowed us to use ARPA funds. ARPA is an acronym that stands for American Rescue Plan Act. ARPA. You allowed us to use the ARPA funds to pay Hill Country to take one of their mental health clinicians, what's called a qualified mental health professional, and we embedded Kelly, as her first name, into our mental health unit. Why? In lieu of the police being the only responders to those calls, we now have a Hill Country licensed clinician in the front seat of the Tahoe also going with us. And we were able to do that through ARPA funding. So I appreciate everybody's vision to do that. Just a quick note, I need 2 of them. With that said, fire and EMS were the primary responding units 10% of the time. Okay. So out of all the 972 calls that did not result in emergency detention, what did the police department do with them? That's a great question that Martha provided an answer. Only 18 arrests out of the 972 calls. So she took it a step further. It's our goal. I can say this, it is the collective goal of the San Marcos Police Department and the city of San Marcos that we identify what's called a least harm solution to divert people away from incarceration if they suffer a mental illness. We want to divert them away from the Hays County Jail. The issue we have, we'll talk about this in just a minute, is divert them to what? Because there is a dearth of resources in San Marcos, but we'll get there in just a minute. So absent those resources, with the 972 calls, I'm actually somewhat pleased to report that we still had a very high threshold for when an arrest would be made, and only 18 times were arrests made. And those arrest reasons can relate to alcohol, assaults, DWI, drugs, violation of court orders, outstanding warrants. Those are the types of charges that you would see the 18 being arrested for. Okay, now we don't want those 18 arrests to be made out of the 1,932 investigations. So if we're going to ultimately move away, if we're going to divert away from the jail, then we have to do different. But what does different look like? We've been working on different for about a year. And I am proud to say that we have multiple stakeholders across San Marcos, the city of Kyle, and Hays County. And we have partnered in what's called the Hays County Behavioral Advisory Team Charter. This is a 6-page charter. It's signed and it's executed. At the last count, I believe we had 16 charter members. You have the judge of the mental health court, you have the district attorney, you have the director of pretrial services, you have a council member from Kyle, you have an assistant city manager from San Marcos, you have 2 people that chair it. I chair it, and so does Judge Elaine Brown with the mental health court. You have a large representation of multiple systems, and obviously you have Hill Country. I forgot Amy. So we have everybody representative, and what we are trying to do through this charter is we're trying to envision different. And this is a public document that I'll be glad to send as well as all of the supporting documentation. Councilwoman Garza, you have a question?
I'm wondering in the composition of this group, is there people who have been directly impacted by like intersections of mental health and incarceration to provide like those lived experiences, like that perspective?
Yeah, and you asked me that question, I want to say roughly 3 months ago. Today was our 6th meeting of the BAT, and I specifically asked your question to the entire group because I'm only one voice among the 16, and the answer was the people in the room, to include CSR, to include Hill Country, they're the ones that are providing these frontline services. So if they believe that we could relate the lived experiences because they're living it right there with them, providing the frontline services. You asked, I'm telling you the answer.
Okay, I will let you proceed. I'm gonna shut up. Proceed.
Don't shut up, ask questions. I want to real quickly talk about, okay, where do we stand at the jail? There's all of this is really, it gets really complicated really quick. At the jail, there is what's called MSU and non-MSU, because when a person with a mental illness is incarcerated pending trial, the defense attorney representing said client may raise an objection about their competency to stand trial. That then becomes an official proceeding that has to be arbitrated in a court of law to determine, is this person competent? If the person is found not to be competent, they are held in the jail pending competency restoration at a state hospital. I'll say that again. When a citizen is arrested and they have an identified mental health disorder, and I listed all of those at the beginning of the session, a defense attorney, or even it could be a prosecutor, or it could be the jail, because they do screenings in the jail. Somebody is going to alert the system that this person likely has a mental health disorder. That then triggers a legal review to determine, are they competent to stand trial? A court ultimately is going to determine the matter. If they're found to be incompetent, they remain housed pending availability in a state hospital. So that is what we call the wait. They're waiting at local confinement for a state hospital to go and get restored, their competency restored. So I reached out today. I finally got it this morning from the Hays County Jail. They have 10 inmates who are maximum security prisoners, inmates. Those are going to be the ones that are associated with murder, aggravated assault, aggravated robbery. They're going to be the more violent offenses. They have 10 of them that are waiting for competency restoration, and their average wait time is 383 days. If you listen to people across the state of Texas, they will tell you that the average wait time for competency restoration beds has been as long as 1 to 2 years. So in the 88th Texas legislature, the one that just concluded, they allocated the most amount of money ever toward mental health services. Specifically for brick and mortar, for more beds, they allocated $2.3 billion. Now it's going to take years for these brick and mortar operations to come online, but that is going to increase capacity by only 2,000 beds. So remember, that is maximum security unit. Non-maximum security, so these are going to be the people that are in there for other assaultive types or other felony offenses that are not considered a violent crime. There are 15 of them in the Hays County Jail. The non-maximum security unit average wait time is 248 days. So we have 25 people in the jail pending restoration. Now, a lot of us could look at that and say, why do they have to remain in the jail until they are ultimately restored? There are efforts underway right now to do different. So I talked earlier about the behavioral advisory team. I talked earlier about it's a multi-city, it's a county collaboration to evaluate that very question. How do we do it differently? I want to give you the 5 goals. This is the roadmap that we are working on every month. We meet the first Wednesday of every month, and we're working toward the accomplishment of these 5 goals. Number 1, we want to expand crisis options through the development of a diversion center. What does that mean? When a peace officer contacts a person in crisis out on the streets of San Marcos, we need a low barrier drop-off center that is not the Hays County Jail, where they can immediately be funneled into some type of an evaluation to determine which level of care they qualify. They can be allowed a cooling off period because some people have an acute crisis that is not chronic. They need that ability to, okay, I need you to calm down. I need you to reflect. I need you to reestablish your baseline, and then ultimately be put back out in the community versus going to the jail. We want a low barrier drop-off center in San Marcos, Hays County. That's our number 1 goal. We are going to speak to the Hays County commissioners next Tuesday morning at 9 o'clock on these very issues. And Judge Elaine Brown is going to kind of roll out our desired roadmap. Number 2, we want to address high needs utilizers and pilot a new assertive community treatment program. Remember, the assertive community treatment is the highest level. It's that level 4 where it's a multi-team approach. We want to identify a program while also focusing on local restoration services for those who are incarcerated. This is a big, big issue for our district attorney. Our district attorney is Kelly Higgins. He said repeatedly in these monthly meetings, we've got to do something to speed up the process for local restoration, because waiting for a year for a bed at the state hospital in Austin is unacceptable. So that's our second goal. Our third goal is to explore the development of a behavioral health office to coordinate county-wide services. This is something that, we in San Marcos have really been sensitized to lately as associated with homelessness. We all kind of know that when it comes to homelessness, there is no one-stop shop for where to go and engage resources. Instead, you have different entities doing different things. The same is true with mental health services. You have police going to these calls. You have fire and EMS going to these calls. You have your local mental health authority. You also have family members contending with family who is in crisis who don't want to trigger the 911 system. And they want to try to figure out how do I navigate this court system, but I do it from a civil confinement perspective, because state statute allows families to do that. We need that one-stop shop, that corporate body of knowledge that is somebody in Hays County, San Marcos can go to and get these answers and then sent to the appropriate resources. That's goal number 3. Goal number 4, we want to increase information and data sharing across the sequential intercept model. Now, I know that's probably speaking Greek to most of us. I want you to know that, I want to say it was probably over a year ago, we had 72 people crammed into the Hays County Government Center, stakeholders from every imaginable segment, to include community, to Councilwoman Garza's point earlier. And we unpacked what's called the sequential intercept model. This is the sequential intercept model report. It's 75 pages long, but this is the work product of 2 days of a workshop. We can share this with our citizens so that they can better understand the deficiencies. But here is the cheat sheet. Everybody loves Cliff Notes. Here's the cheat sheet. This is a 2-page roadmap that distills 75 pages down to 2 pages. And it ultimately says, look, you all came up with all of the needs, good needs assessment. What are you going to do about it? This is that. So that has also been done. So that is goal number 4, increase information and data sharing so we can address this sequential intercept model. And number 5, our 5th goal is to enhance 911 and law enforcement response to behavioral health crises. Well, that's great. That sounds like a great tagline, but what does that actually mean? Well, the perfect example is using those ARPA funds to pay Hill Country for them to give us a clinician, for that clinician to sit in the police unit so we have a co-responder unit. I want to do more of that. And speaking to Todd Citron and Amy Lowry, they want to do more of that because they're doing the work anyways. Might as well, it makes more sense to do the work together further upstream. So that's part of number 5. We want to do more collaboration. Now, I'm almost done, I promise. One of the additional things that has occurred is as Hays County, the Commissioner's Court specifically asked for a mental health needs assessment. This is the final report released November 30th of 2022. It is 182 pages. So it's excellent reading. It's excellent reading. Just keep telling yourself that. But really what this does is it identifies the remarkable deficiencies, but the remarkable opportunities to do more through collaboration. So I want to say this with a level of certainty. A lot of people have asked the question, what is the San Marcos Police Department doing about mental health? And my answer is a lot, a ton. I hope this very short presentation has given you just a glimpse. We can provide some of these public documents to everybody else so that you can have a more holistic understanding. But I'm proud of what the sworn officers and professional staff have done. I'm proud of city administration. I'm proud of council. I think there's been a lot of collaboration. I'm also proud of the Hays County commissioners. Commissioner Inglesby is on there and Commissioner Walt Smith is also on this behavioral advisory team. So I think a lot of work is being done. I want to reassure our citizens, but folks, the system is so overwhelmed right now. We need to do more. So with that, I'll be glad to entertain any questions from myself or Todd or Amy. Thank you.
So, Chief, is it okay if I make a comment?
It's okay with me. Councilwoman Garza, are you good? So
Okay.
Todd Citron is the CEO of Hill Country. Go ahead, sir.
All right, thank you. So from Hill Country here today is, again, my name is Todd Citron. I'm the CEO. I've been with Hill Country. Today marks 2 years for me, as a matter of fact. I have with me our deputy CEO. He's sitting next to me. His name is Landon Sturdivant. Also joining us is Ashley Miller, Dr. Ashley Miller. She is our Director of Behavioral Health Care Services for Hill Country. And then Amy Lowry is, she's the director of our clinic, the Shibe Clinic, which is located in San Marcos. And so I just wanted to make reference to a couple of things as kind of to tag on to what Chief Standridge had said. In regards to the sequential intercept mapping exercise coming out of Hays, and again, that was it was the Health and Human Services Commission's Office on Forensic Coordination who performed that. And I think, Stan, the number one recommendation coming out of that was the diversion center. And so as Chief Standridge had mentioned, we just wrapped up a legislative session a month ago. A lot of money was pushed into mental health and a lot directed towards bricks and mortar. You mentioned the $2.3 billion. In regards to your forensic waiting lists, Chief had mentioned, I think you got 10 on the MSU, which is the most severe offenses as a manifestation of the mental illness, and an average wait time of 383 days. And then 15 in the non-MSU beds, or a wait time of about 250. So you got 25 folks in the Hayes Jail that are on what's called a long-term forensic waiting list. There was a lot of stipulations in regards to the expenditure of this $2.3 billion in new psychiatric facilities, whether those would be state-run psychiatric facilities or those would be like public-private partnerships. There were stipulations that 50% of these new beds that were coming online would have to serve folks who were on these waiting lists in jails all over the state of Texas. So I think that's some good news. Also in line with the desire for, if Hayes is moving in the direction, and it was, I think you'd mentioned, Chief, it was your number one goal of the behavioral advisory team was this diversion center. There's a pot of money, 4 counties, $100 million for the building of these crisis centers, diversion centers, crisis stabilization units. So there's money there, and I think Hayes County would be a prime candidate to be able to, access those dollars in regards to the building creation of a diversion center, as the chief had outlined. So I just wanted to just reference a couple things in regards to, we have a wonderful partnership with the San Marcos Police Department. We are the local mental health authority for a 19-county catchment area. Hayes County is our largest county, and Hayes and Comel on the I-35 corridor. And then we extend all the way west out to Valverde. And so we've got your population, which I think is in excess of 250,000 people. And then we've got some counties where the population is less than 2,000. So we go from big city, suburbia, and run all the way west out to, the Mexico border. And so I just wanted to kind of give you a little bit of information about us, and then to follow up on a couple of the points that the chief made.
Could I ask a real quick question? And it's not so much for this. We know that unfortunately there are hospitals that are closing. I don't know if they're located in the areas where this need is, but did the state look at maybe to get up and running quicker, acquiring some of these hospitals that have closed for this purpose? And that's I guess that answered maybe for another day, but it was just a thought.
I apologize. This is Landon Sturdivant with Hill Country, and I apologize. I'd be joining in my office, but I was having difficulty with the technology today. Certainly, I think that one of the goals of putting out the funds that Mr. Citron referenced for additional crisis diversion beds was trying to fill the gap in between those, because there's many of the individuals that we serve in crisis. Once that those individuals can be served for a short period of time, just as the chief had stated, may have a cooling off time period and may not ultimately require the level of treatment that an inpatient psychiatric unit would do. Another element that some communities have looked at doing is partnering between the local county, city, and a hospital with the local mental health authority, in going into a partnership to set aside certain number of beds within those hospitals that could fulfill that function of that acute psychiatric inpatient treatment.
Okay.
Let me offer some perspective, because when we talk about the maximum security unit inmates who are awaiting competency restoration, and then the non-MSU inmates, non-maximum security unit. So I'm going to pick just a county at random that is probably somewhat comparable to Hayes County. I'm going to pick Bell County. Bell County has 19 maximum security. They have 31 non-maximum security. So it's important when you share data that you have it in relation to something. It has to be comparative. So I'll offer that. Let's take Smith County. Smith County has 21 maximum security, 47 non-maximum security. Now, our district attorney said something today that I actually wrote it down. He said, folks, because of a lot of different efforts coalescing, our jail population is down today from what it was. There's progress being made. And Todd, I appreciate you and your staff, but there's progress being made across that, what I call that SIM, that sequential intercept model that literally starts at 0 and goes all the way up. There's progress being made at every level. And myself, Stephanie, and Chase heard this recently. We heard it last week. A very wise guy said, you're not going to accomplish 100% of everything you discuss, but you're going to accomplish 0% of what you don't discuss. So we are discussing mental health at an incredibly elevated rate here in San Marcos Hayes County, because personally, I believe from both personal and professional experience that the system is overwhelmed. So we have got to build in relief systems. We have to build in release pressure valves to help. And you have a lot of people working through this behavioral advisory team to do just that. And we hope to educate our commissioners court next week on everything that's being done.
Thank you, Chief. I'm wondering if there's anybody from the public that has any questions, because we're getting close to 3 p.m. If so, if they could just raise their hand. Comments, questions, concerns, burning desires. I take that as a no. I'll just give one comment. I appreciate the presentation. Yeah, you mentioned, folks asked like what the police department is doing about mental health. I think my question personally is, why are we asking the police department, like, why are we tasking them with having to handle mental health? I understand the intersections and I appreciate the willingness and the creative approaches to accomplishing that. But as a policymaker, I think the challenge is, how do we stop applying band-aids to like massive wounds, right? Like our neighbors need robust mental health services even before, ideally before their intersections with police, right? So I appreciate the presentation. I think it highlights the needs that the police department has to try and put more band-aids on gaping wounds. But it does leave a lot to think about, right? When we talk about a substantial portion of our budget goes to policing, how we have to kind of balance out, addressing the need alongside our neighbors throughout the county and stuff. I think it's helpful information. I wish there was better, more clear solutions, but I appreciate the scoop. Something to contemplate during the budget.
Definitely.
Budget talks.
If I could touch on your question, I know it's kind of rhetorical, but I appreciate you asking it, because your police leaders and your police officers ask the same question, right?
Okay.
The profession is much different now than when I entered it 31 years ago. And what we've learned is that, and the mental health is just one of many examples of this, but what we've learned is that when systems in local, state, and federal government fail or wither away and kind of die off, and the problems that they left behind still exist, there's nobody left but the cops to deal with it, because people that are experiencing side effects of whatever the issue is, whether it be mental health, substance abuse, problems with their neighbors' animals, whatever it is. If those organizations and they go away, or maybe they just don't answer the phone because they're not a full-time operation, the police are the only ones left who can't say no. When they call, they have to address something. They got to do something. And for years, the police just said, okay, well, it's our job and we're going to deal with it. We're going to handle it. And we're starting to realize finally, that's not the right answer. The police need to be plugged in, continue to be plugged in as part of the solution, but it can't be just on them. And that's why I'm so proud to see what we're doing locally, because we're stepping in the right direction. You're right, it's not enough yet. It's too little, maybe too late, but we're getting there and we're making big strides.
No, I appreciate the that perspective. I think it's necessary as we contemplate how to proceed, right? Because, what impacts mental health, right? It's a lot of times stressors and things that that policymakers can influence, right? So like access to people's basic needs, their housing, a safe place to stay at night, workforce training, and so on and so forth. So it's like holistic, right? So I appreciate that. Does anybody else have anything to add before we kind of close out? Damn, I was hoping somebody would have a question, though. I could bring up the agenda to make sure that this is the only thing that's on there. I think it is, right?
It
Let me
is.
double check. Okay, cool. Well, thank you,
Consideration
Chief.
of consideration of agenda items. That's the next thing for next meeting.
Right. I think for next week, we can talk about maybe better improving systems to select meeting format and making sure that folks have the opportunity to participate when we have good meetings. I just want to apologize to the folks who made it in for the confusion with the Zoom link. We're gonna work through that area of growth to ensure that confusions don't happen in the future. So I appreciate your patience and grace and your taking the time to participate in this meeting with us.
Thank you.
Mary, did you have anything you wanted to put on the agenda for
Yeah.
next?
I sent a list. Actually, it was for this meeting, but clearly this is much more important than what I had sent in about reports and statistics.
Oh, right. Did we dump that in here for the next time though?
I don't see it, but, and it doesn't have to be next time. If we've got information, follow up on this. This is clearly, more important and more urgent, but when we don't have something else, because we're always wanting to see about reporting, and that's something that I would like to learn more about out of the
Right.
police reporting.
Yeah. And I'm not sure if I did this like verbally or maybe in my head or maybe directly to the mayor, but I do second mayor's request to discuss that. So if we can just I miss Tammy, if you could help us just like copy and paste that. You know how we used to have kind of like a little in limbo or like a to-do list of topics to cover, that'd be helpful.
Yeah.
Okay, I think
Let me
that's
ask
it.
one question real quick. Councilmember Gaddis, so Chief Standridge, when should we anticipate the information being distributed as far as presentation and the data, and how will that be distributed to everybody that is on this meeting and beyond?
Yes, ma'am. I saw Martha and Tammy working through some final edits on the memorandum that codifies the data, the 353 days of data. Once I have that, I'll be ready. The other 3 inches is I've already got all that. I had to get all that stuff printed and stuff, and I've got that saved electronically now. So I will get that by day's end.
Yeah,
Okay.
but we need a way to communicate this to the public, because 99.8% of the public doesn't know, probably may not realize the magnitude of the issue. And then secondly, even those who know, there is some issue, to put it lightly, what's happening. And I know that we don't have the facility yet, and we don't have this yet, but we are so far along in getting the plans of what we're going to do. And fortunately, thank you, federal government, we've got some funding that I think it's important. I would also be curious when we have a follow-up on this, is to see what our nearby counties are doing, what their commissioner courts are doing, because I know what I heard from one county judge as to what they were looking at. And I think that there could be a lot of partnerships. I don't know that we need one of these facilities in every county, and there's not enough money for that, even if, there was a desire for that.
Mayor, if I could make a comment about that.
Yes, sir.
So we've got 19 counties in Comal County. They are building right next to their jail a 16-bed crisis facility to be 6 extended observation unit beds and 10 crisis residential beds. And it would be kind of classified as a diversion center. And they're building that out of their, their Comal County tax revenue. And we are working with the state, where the state would fund us for operations. Now, we, in our role, we have to serve folks from all 19 counties.
Right.
In any of our facilities. So we are expecting that we will serve Hayes residents at this facility to be sitting right on I-35.
That sounds good. So it would still be good to know in your 19 counties, where, because I'm assuming we're kind of on the edge.
Yes,
And
yes, you
so
are on
anyway.
farthest eastern point. Yes.
That's what I thought. Okay, so yes, just where, anyway, just those next steps as that money gets, and who's determining how many billion gets spent, and who gets it? Is it proposals and somebody makes a decision?
Yes, Mayor. The Texas Health and Human Services Commission will be releasing here probably within the first quarter what they call a needs capacity assessment, which is basically a procurement that we could then go in with the county and the city to propose a project that will then go to the Texas Health and Human Services Commission for them to take into consideration for use of that $100 billion that Mr. Citron had referenced.
Okay. All right.
So
I
just
think-
want to make sure for the, so it's, you said by day's end, Chief, is that going to be on the website for everybody to access? Will it be emailed, or how are we going to disseminate?
I don't have a clue. I'm going to ask Lauren Surley, the Director of Communications, how it's going to be disseminated. That's probably less my decision as it is to their decisions.
Okay.
I see Miss Stracos has her hand up. I don't know if it's.
Hello there. Yes, it is. It's in response to Ms. Reyes. Our communications team is collaborating with us on getting this information out in a timely and efficient manner. They have a distribution list that they will go back and send out this information, make them aware of where to go to find it. I have left a message with Lauren Surley, our communications director, so that we can move this out sooner rather than later, especially in light of our challenges with communication today. We want to make sure that we're getting this out in a timely manner. So it will be my focus over the course of the next day. I am hoping that with her team, we can get this pushed out by tomorrow.
Excellent. I will ask that they contemplate that the constituents that I invited or I think would be interested in this are not on that distribution list. So perhaps putting it somewhere online where they could access it with a link, maybe sharing it on Facebook or something might be helpful. Yeah.
I thought that what the distribution list was going to get was a link to where it is on the website for public.
Yes, and I would like to clarify that is correct. They
perfect.
had
Okay.
they put it on Facebook, and the link was immediately corrected once I spoke to Lauren earlier. So they are in real time able to update those things. So we will
Perfect.
get that addressed, and I appreciate you all. Thank you.
Thank you, Tammy. And
Excellent.
Lauren is actually outside my door waiting to meet with me. So I will talk with her about it as soon as she gets in here. So thank you so much. Appreciate it.
Yeah, I know they work hard to address areas of growth on that end. So thank her for us, please. Okay, then we're adjourned at 3:06. Y'all enjoy the rest of your day.
Thank you all.
Bye.